Hi everyone, Sam Vollens here from Shoulder to Wrist. I want to talk to you today about carpal tunnel syndrome. So, the carpal tunnel is a space in the wrist and the palm of the hand, just around here, that transmits all the tendons that supply your hand, but also a nerve called the median nerve. And the median nerve is responsible for sensation of the thumb, index, middle, and half the ring finger, and also thumb function, the muscles that allow you to grip using the thumb. Now, carpal tunnel syndrome is when that nerve, the median nerve, for whatever reason, gets pinched under a tight band of tissue that runs across the palm just here. And there can be a number of causes of carpal tunnel syndrome, as it's called, and they sometimes are reversible, such as if you're slightly overweight or you have problems with your thyroid or you're diabetic. If you can get on top of those issues, then sometimes the problems go away. But classically, we see people complaining of pins and needles, sometimes at night, sometimes during the day, and numbness affecting these 3 or 3.5 fingers. And sometimes they can't feel things in the hand and drop things regularly. And that's the sign of carpal tunnel syndrome. In addition, some people complain of pain in this area radiating into the forearm as well. So all these things can be a sign of carpal tunnel syndrome. And it's normally in people over the age of 30 rather than younger individuals. But people over the age of 40, 50, 60 can get carpal tunnel syndrome as well. In terms of management, some people suggest wearing splints at night. If the problem that you have is only related to night pain, then you can wear a splint to keep the wrist still, because we know that when the wrist goes flex like this and you sleep on your side, you can sometimes get pins and needles in the fingers. So by keeping the wrist straight, it tends to prevent those pins and needles and irritation of the nerve at night, and sometimes that can be enough to settle it down if you splint the wrist for about 4 to 6 weeks, something like that. In addition, we can do steroid injections if we think it's an inflammatory cause, where there's some inflammation around the nerve. If we pop a steroid injection just into the wrist here, and that can settle it down indefinitely, so forever, or sometimes it settles it down for a few months and then the problem returns. If those treatments don't make you better, then it might be that you need to consider having a procedure to release the median nerve in the palm. That can either be done with an open technique, where we make an incision in the palm this way, under local anaesthetic in an outpatient setting, or we can do it endoscopically, which is essentially keyhole release, where we pop a tiny little incision in the wrist and we pass a camera up, and then we release the ligament without making an incision in the palm. Both treatments are identical in terms of their outcomes and their complication rates. However, the reason why someone might want to consider the keyhole, the endoscopic option, is because then there's no incision in the palm, so you can use your hand straight away and you can do both sides in one sitting, rather than having to have one hand done at a time, because obviously you need your hands for personal hygiene and other activities of daily living. Other than that, they're the same outcome. In terms of what you can expect on the day of your surgery, you'd come in into outpatient setting. You'd have some local anaesthetic injected into the area that we're going to do the operation. You'd let that work over 20 minutes or so, and then you'd come in, lie down on an operating couch, and have the endoscopic or the open carpal tunnel release under local anaesthetic. Then we'd stitch you up, put a dressing on, and sometimes a bandage. Occasionally we use a tourniquet around the top of the arm just to stop bleeding, but on most of the occasions we do it without tourniquet, and we'll discuss that more with you in clinic. Recovery wise, depends again on whether you're having it done open or keyhole. It's about 2 to 3 days in a bandage, and then you've got a waterproof dressing on, so you can start showering and washing at that stage. And then if you have it done open, you're probably looking at 4 to 6 weeks before you feel like the palm's comfortable enough to start using the hand fully. If you have it done keyhole, then from day 5 really you can use the hand. It feels a bit stiff in the hand sometimes, but the wounds are well out of the way and they don't affect your activities of daily living. The success rate's high, so over 90% of people are happy with the results of surgery. And by 4 to 6 weeks, as you start to use the hand again, you should be more or less back to normal. It can take a bit longer, and sometimes people have a bit of a thickened scar from the open carpal tunnel release, which needs a bit of scar massage with some E45, some bio oil or some Vaseline, and then that will settle down over the next couple of months. So that's carpal tunnel syndrome in a nutshell, the treatment options and the surgery. If you've got any further questions, then please do not hesitate to get in contact with us.